Assalamu alaikum. Welcome to today's session on general. In this session, inshallah, I will try to cover the general organization of the human body and the structure in respect of gross anatomy, and I'll try to correlate the function with the structure. The gross anatomy means explaining or narrating the structure by observing. So gross anatomy of the human body means what we see will narrate. So the body, if we take section, we'll find that the body comprises of wall, you can see, and inside there is space. The wall comprises of the skin, fascia, and the muscles in layers, and the cavity contains some organs who makes the systems of. So let us start with the skin. Skin covers the body. The total body is covered by the skin, and skin is considered as itself as an organ, and it is actually the largest organ of the body, the heaviest one. It protects the soft structure inside from the injury, which may be chemical, thermal, radiational, and so on. It also protects those from dehydration. It helps in regulation of the temperature in different ways. It helps in the synthesis and also store the vitamin D. It is responsible for sensation. Actually, sensation means registration of sensation by the brain. So brain is responsible for telling whether it is touch, whether it is pain, and so on. So it should be carried from the outside, from some places. That is known as the sensation, and it starts from the receptors. In the skin, the receptors of general sensations are there, but the specialized sensation has the spatial organs. Like for the visions we have eye, for the hearing we have ear, for the taste we have tongue, and the nerve supply of the skin has some clinical importance. You see, the skin is segmentally supplied, means each area is supplied by a particular segment of the spinal cord or particular part of the brain through cranial nerves. So we can simply touching some part of the skin, we can say that this area has correct sensation, means this area has intact nerve supply. So if sensation is lost in some segment, we can say that this segment of nerve is injured or suffering from the disease. Skin also indicates some diseases like pigmentation, so some nodules, some features on the skin indicates some diseases. We can check the hydration status by observing the nature of the skin. You see, often we listen and use that the person is having certain percentage of burn. This is actually calculated by the involvement of skin. The skin receives the nerve supply segmentally. So each segments are separated and can be identified on the skin, and this is called the dermatom means an area of the skin, the sensory supply of which is from a single segments of the spinal cord. So we can identify the dermatom specific areas like the level of the umbilicus, means the navel. This skin is supplied by 10th thoracic spinal nerve. Similarly, the little finger area, the skin, is supplied by cervical number 8. So in this way, we can identify. Skin comprises of the superficial layer and deep part. The superficial part is epidermis. I am indicating it in the figure, this is the epidermis, and it comprises of stratified squamous epithelium which is keratinized. Deep to this lies the dermis. The dermis is actually connective tissue, and its superficial part is loose connective tissue and deeper part is dense connective tissue. So always you see the epithelium is avascular, so it remains with the connective tissue, and dermis is the connective tissue component of the skin, and epidermis is epithelial component of the skin. Under this skin lies the subcutaneous tissue. Sub means deep to, and sub also in under. So it is under the cutaneous, under the skin. That's why it is known as subcutaneous tissue. We use in gross anatomy the superficial and deep fascia. So just close to the skin is the superficial fascia. This superficial fascia is composed mostly of the loose connective tissue. It is composed of fat mostly. It stores fat, and also some of the glands like the sweat glands of the skin enters into it. So it also contains the blood vessels, lymphatic vessels, and nerves running towards the skin. Functions of the subcutaneous tissue, means superficial fascia and the deep fascia, includes that it is the place where the major amount of the body fat is stored. The amount of a fat varies from side to side. As for example, we can say the abdominal region, means antral wall, this front wall and wall of the abdomen, means the belly, contains more amount of fat than other areas. The sex variations is also observed. Female, the tendency of accumulation of the fat under the skin is more. The amount of fat is more in over-nutrited persons. This layer allows the free movement of the skin over the body, and this prevents sloughing out of the skin with easy rubbing. It provides a padding effect. I can give one example like the sole. The fat present in the sole, they works as a pad and prevents the skin from compressional injury. We always stand on the sole, also we run, walk on the sole, but skin remains intact. It is responsible for regulation of the temperature. Actually, this layer works as a jacket. It's an insulator for the temperature. There are some areas without fat. We can give example as no fat areas are the eyelid, the nipple, the areola surrounding it, and also some parts of the external genitalia. As clinical significance, we can mention that there are some large veins in the subcutaneous tissue, means in the superficial fascia. These veins are easily visible, so doctors can see it from outside and can approach with the needle easily through the skin. So they can prick the needle, and arterial bloods has high pressure blood, relatively low pressure bloods are present in the veins. So doctors can easily prick this area directly and can give infusion or injection directly into the blood. Under the skin, in the superficial fascia, we will find some lymph nodes. These lymph nodes are called the superficial lymph nodes. Here we can see this is the inguinal region, and it is having some superficial lymph nodes that collects lymphs from different parts of the lower limb. And you see this can be seen through the skin and we can feel it, palpate it when it is enlarged. So when for the clinical purpose, this lymph node can be removed for clinical diagnosis. So this helps in identification of some disease, also some very critical diseases. under the superficial fascia. So from the skin we start, this is the skin, then we'll get the superficial fascia, and deep to this superficial fascia lies the deep fascia. This deep fascia is dense connective tissue layer, and it is in elastic covering of the body. This is present in all parts of the body except the over the belly. In the abdomen, this is absent, and this makes some septum, means partition wall, continue into the inside the limbs to divide the limb into different compartments containing muscles. So these are known as septum. Septum means wall. So this deep fascia forms the septa, plural number of septum, and allows the muscles to remain separate from other group of muscles, and also provide area for the attachment of the muscles. Muscles remain attached to the bones as well as the septa. These thickens around the wrist and ankle joint to form the retinaculum, means is a thick band attached to the bones. So these bands, these are known as retinacula, helps the tendons to keep in position during vigorous contraction of the muscles, and works as the pulley so that this can smoothly work. This muscle can smoothly work. So far, we have discussed that the wall of the body comprises of skin, then the superficial fascia, and deep to that lies the muscles and bones. In the limb, we will get only the muscles and bones inside, but other area we will find that inside the bones and muscle there are spaces. This is known as body cavities. And you see, this is the body cavity, and the cavity contains some organs. This makes the system. That cavity is not present in the limb. This is the thorax, you can say chest. Actually, the English language is chest, and if we take the section, we'll find that this wall has all the structures, like from outside inward, the skin, superficial fascia, deep fascia, muscles and bones, and inside there is space which contains the organs. Here you can see the two sides occupied by the lungs, and inside middle part is occupied by the heart. So these organs, so you got the idea that there are spaces within the body, and these are known as cavities. So the head contains one cavity that is known as cranial cavity, and this cavity contains an organ known as brain. In the thoracic region, we have one cavity known as thoracic cavity that contains the major two organs, two types of organs, one heart and two lungs. In the abdominal region, below the diaphragm, means inferior to the diaphragm, up to the lower part of the trunk, the cavity is known as abdominal cavity. This contains the digestive system, but below the inlet of the pelvis, the lower part, this is conical area, is known as pelvic cavity. This is primarily containing the reproductive organs and also the lower part of the digestive system. In the posterior part, in the posterior wall, there is vertebral column, and in the vertebral column we will get the vertebral canal that contains the continuation of the brain as spinal cord. As per the position, we can classify the body cavities into two groups. The part of the cavity that is present in the head is the cranial cavity, and this is continuous with the vertebral column containing cavity, which is known as spinal canal. They are remaining in the posterior part of the body, so these are called dorsal cavities. On the contrary, we have the thoracic cavity and abdominopelvic cavity, which is again divided into abdominal cavity and the pelvic cavity by the position of the pelvic inlet. They are relatively in ventral aspect, so these are known as ventral cavities. So to summarize the learning of the gross anatomy, we have understood that we should know the wall. So whenever we will study the abdomen, we will first start with the wall. Similarly, thorax, we will start with the wall. So in the wall, there are skin, superficial fascia, deep fascia, and deep to that are the muscles and the bone. So for the muscles, we must know the name of the muscle, where it is attached, what is its position, and we will correlate the position and the attachment with its function, that is known as action. We will try to understand the bones, their features, and the joint formed by them with the uh, movements of the joint that is allowed at that particular joint. So in this way, we will proceed further to identify the organs present in that area. Separately, we will discuss the gross anatomy of each organ, and then we will try to correlate the function subsequently as a system. Thanks for staying with me. Thank you very much.